PR Connections Radio presents.
Did you know your clothing could help balance your body's pH levels? Our cutting-edge fabric technology naturally promotes optimal pH balance, helping you feel energized, refreshed, and at your best every day. Use promo code PRTalk for more info. Tap the link in the description or contact our experts at 702-445-9488 to learn more.
Welcome to Watching Mental Health, where we break down the stories, stigmas, and research in mental health. It's time to have an open conversation. So let's talk about it. Hi, everyone, and welcome back to another episode of Watching Mental Health. And I am so excited to be here today because it's been, I think a few weeks since we've come together. So I'm glad that we are all back. And then I'm really excited about my guest today. I've been following him and I've been following his organization for a few years now. And I think it's just going to be a really great conversation. And so today we're going to be talking with Dr. Sang-Hoon Lee, who's a licensed Oriental medicine doctor in Nevada and a California acupuncturist since 2015. So he has over a decade of experience in acupuncture, in herbal medicine, including 5 years treating patients in psychiatric clinics, and as well as pain management and physical therapy settings. Dr. Lee currently practices at Wongu Health Clinic or Wongu University here in Las Vegas. And in this episode, we're going to be breaking down how effective Oriental medicine, herbal medicine, acupuncture, and these approaches to mental health really are. And what is the research and what has Dr. Lee seen in his own experience? And so with that, let's bring Dr. Lee to the show so we can talk.
Thank you for having me.
Thank you so much for being here, Dr. Lee. And again, I'm just really excited to have this conversation. We haven't spoken about Oriental medicine or herbal medicine in its approach to mental health before. And I know that, there's that big difference between Western medicine versus Eastern medicine. And I'm just so interested in how, mental health can be approached from both sides. And so I'm really excited to have you here. And so with that, just first, tell us a little bit more, about yourself and, how you came in to this area of specialty that you practice.
First, my name is Sang-Hyun Lee. I'm working at the Wongu University of Oriental Medicine. I have been practiced in the Nevada for about 4 or 5 years. Mm-hmm. And at the beginning, when I start being in the mental health field is about somewhat 10 years ago.
Oh.
After I got the license in California, my first job is acupuncturist in the psychiatric clinic. So my boss is the psychiatrist. So his vision is to offer the Western treatment, psychotherapy by the psychologists and MFTs. And in addition to it, he also wants to provide the acupuncture and herbal medicine as a non-pharmaceutical approach. So that's how I start working at his clinic called the Insight Choice.
That's amazing.
So for about 5 years, most of the patients are referral from the other MD, the psychiatrists, psychologists, and then LMFTs within the outpatient setting, the clinics.
Very cool. So did you find that applying acupuncture was effective for the patients that were in those settings? It seems like it was because you were there for 4 or 5 years, right?
Oh, yes. But at the beginning, I was also not so familiar with the mental health field because what we expected is most of the public patients expect some musculoskeletal pains. Many people come to the Wongo Health Clinic for the low back pain or the shoulder tension, isn't it? So at the beginning, I was more pay attention on the musculoskeletal since most of the majority of the patient referral is about the anxiety, depression, ADHD,
Mhm.
and PTSDs. So while I was working there, I was able to see some of the anxiety, depression, the intensity is reduced.
Mm.
And especially that the clinic that I used to work, most of my patients are with the psychiatric medication, like some
Yeah.
Lexapro or the Wellbutrin.
Yeah. Yeah.
And common side effect is the secondary insomnia or the other GI concerns. Or
Yeah.
mm. So what I was able to experience again is not only those psychiatric condition, but also they're possibly associated that the secondary other the complications too.
That's so interesting. I hadn't thought about that, but yeah, that would absolutely, because the side effects can be really hard on people with long-term medication use. And so that's really interesting that acupuncture was there for that level as well. When did you start applying herbal medicine to it?
Oh, at the beginning, I start with that acupuncture only,
Hmm.
and about the few about a year later, I started using the herbal medicine because what we get trained in the acupuncture school is we learn acupuncture and herbal medicine together.
Okay.
Hmm. And herbal medicine, what I used to start using is the powder form. So I get the herbal medicine from the herbal company, the
Hmm.
pre-made herbal medicine. And after that, I also cook the herb by myself. And then order the liquid, a little bit more, the strong, more extractive version of the liquid formula. So based on my like understanding of the each patient in front of me,
Hmm.
there's some Oriental medicine perspective diagnosis. So based on my the diagnosis, I prescribe the acupuncture point combination and herbal formula combination too. So that's how I start using the acupuncture and herb together.
That is so interesting. Did you find that patients that were combining maybe both approaches, that Western, talk therapy approach with herbal medicine and acupuncture, did you find that they were more that they benefited more from the combination of that? Or did you find that really just applying acupuncture and herbal medicine was to help with a lot of those side effects as they were going through talk therapy and or medication use?
I prefer more the combined treatment. So not recommending like a dramatically just discontinue other the medication or other therapy. Want to go together with the other psychiatrists, psychologists, the treatment. With the acupuncture, I was able to reduce the intensity or frequency of panic attack.
Hmm.
That was the very common symptoms. Like they used to suffer the often panic attack almost
Hmm.
like every day. They reduced the somewhat once a week or so. So
Wow.
I wanted to share the result with other providers and some of the psychiatrist or the nurse practitioner ask the question, what kind of the herbs that I use or
Mhm.
the what kind of the progress that I see. Then we have a little bit more the discussion as well. So I prefer more combined treatment, combined treatment with them.
Yeah, yeah. I think that that's probably powerful to combine the treatments. I had no idea that acupuncture could help with panic attacks. That's really powerful to know that. And it seems like you've really seen a lot of powerful things coming from just applying this Eastern approach to these Western kind of, treatments that are already in place.
Thank you. Because when we think about the acupuncture treatment, we're inserting the hair thin needle in the certain spot, isn't it?
Yeah.
So when we insert the needle, inserted area is stimulating local the tendon or the muscle.
Mm.
Another perspective of the understanding acupuncture treatment is uninserted area is like a disturbing the electromagnetic field on the body.
Yeah.
And by this, the acupuncture needle insertion in the certain combination of the spot or the ear or other places also stimulate the brain function too. So I often encounter the often panic attack with the high anxiety level patient. After the acupuncture, the treatment, they becomes very calm and more relaxed.
Wow. That's so nice. So
Mm.
let's back up a little bit. What is, in your opinion, kind of maybe the differences in approaches to mental health from a Western perspective versus an Eastern perspective, or um, not just treatment, but how you approach mental health? Is, I know here in the United States we have a lot of mental health problems, I think, but we don't talk about them, and maybe we experience a lot more anxiety. And so I'm just wondering, what from your perspective have you seen, from the Eastern medicine perspective?
As an educator's perspective, we
Yeah.
have a master program of acupuncture and herbal medicine,
Mm-hmm.
which is about 4-year program. We also address the mental health concern on the senior advanced level classes.
Okay.
How, However, at the beginning, introductory Oriental medicine theory class, we also address the mental health related concern
Mm,
because the Oriental medicine main important keyword is linking, linking and associating.
okay.
Group of the muscles on the arms and leg part of the body is relevant, is linked to the some of the 12 organs we have.
Mm-hmm.
This group of the muscles relate to the stomach. That group of the muscles are relate to the intestine, something like this.
Mm-hmm.
And when we get to know this group of the muscle, we call it as a meridian is linked to the certain one of the 12 internal organs.
Mm-hmm.
So it affect to the internal organs function. One more thing is relevant emotional issue. Each different organ is relevant to the each different types of the emotion.
Okay.
Some organs is relevant to the feeling more anger. Some others are feeling more worried or
Mm-hmm.
scared or too much joyful. So, linking this mental health condition is very common. Like when we think about some organs function.
Mm-hmm.
So, in the Oriental medicine perspective, this the mental health we can regard as the one of the some imbalance of the certain organ, so we can reach the yin and yang balance.
Yeah. That's amazing. I love that approach. I think that yin and yang balance is important. That's something I really love. So tell me more about what Wangu University offers and kind of the different services. It sounds like you don't just, I mean, and you don't. It can help with so much more than mental health. You also help with pain management. I know I mentioned um, in my intro, and I mean, chronic pain management is a big issue that can lead to a lot of mental health problems here. Just in People are continuously trying to figure that out between our opioid epidemic, and so I just think that that's really cool. So tell me more about some of those services and the various services that Wangu offers.
Wangu has the two different service. First service is about education.
Mm.
We offer master program of acupuncture and herbal medicine that we teach acupuncture and herb as a treatment method. Western medicine, Oriental medicine as the appreciation of the patient's condition. With 1,000 hours of the clinical internship, we provide this almost 4 year length of the master program. So the alumni can take the national exam, open their own acupuncture clinic, receive the either regular or the insurance patients also,
Hmm.
or work in the other hospital or work with the Western healthcare provider, just like me before. Second service Wongu provide is the clinical practice. We provide acupuncture, herbs, cupping, moxibustion, or other modalities.
Mm-hmm.
The most common symptom is the chronic pain. Is
Okay.
you and one of the main keyword of the chronic pain is the frustration.
Mm-hmm.
People frustrate on their own pain and many different trial before. Not many people come to the Wongu as a first
First,
treatment.
right. Right.
Yeah, many people went to the different
Mm-hmm.
clinic, different hospitals
Mm-hmm.
before they give up, or then they come to the Wongu. So what we do is with the acupuncture treatment, uh, by acupuncture treatment is like muscles are a little bit like some more squeezed, but they're relaxed.
Mm.
As we know, we have many different muscles, isn't it?
Yeah.
Muscles are working like a orchestra, or muscles are working like a basketball game. In the basketball game, there's five guys work like a play together
Mm-hmm.
against to the another five guys, isn't it?
Mm-hmm. Mm-hmm.
So when we stimulate a certain group of the muscles, their friends who works together, they're adjusting their tension, they're readjusting their orientation.
Mm.
Then it also affect to their enemies. On other side, these five guys, they're also accordingly make a balance to each other.
Right. They're moving off of what they're doing.
Hmm.
Mm-hmm.
So it's I believe that there's no muscle works solo.
Mm.
Every muscle has their friends and enemies.
Okay.
What we need to do is that adjusting their orientation and tension and have a balance to each other. That's how we reduce the tension and gradually reduce the pain level and frequency.
Wow. Wow.
It's
That's
very simple,
amazing.
isn't it?
It's so connected. Everything it's so linked is what I'm getting at between our organs and our muscles and our mental health. It's all connected in various ways.
Yes, it is. And another method is the herbal medicine.
Yeah.
Last almost 3 years, we have been very emphasizing the herbal medicine
Hmm.
because when we teach this master program, we even spend more time on the herbs than acupuncture.
Wow.
And we think the main weapon is the herbal medicine. We teach 200 different single herbs and 160 combination of the herbal formula.
Wow.
One of our strengths of Oriental medicine is long history.
Yeah.
When we think about our ancestors or the 500,000 years before, there
Hmm.
must be the numerous obelisks try their best to help their patients, isn't it?
Hmm. Yeah.
So almost there must be thousands, millions different types of the herbal formula.
Hmm.
Nowadays, based on the Department of the Education's guideline, we select about 200 herbal formula that has been commonly used and have the good result.
Mm.
Those formulas are in the textbook. What we do is very simple. Copy and paste to the patients. Copy and paste from the textbook.
Hmm.
So based on our diagnosis, this patient has too much high anxiety, and based on the Oriental medicine, it seems like either the heart function related, heart meridian related.
Mm.
Then we use the herbal formula targeting the heart to cool down and calm down. Use
Mm.
the acupuncture points to relax the heart related muscles and the tendons too.
Wow.
Mm.
Yeah, that's a lot. I mean, over 200. I to go through all of that, I'm sure you do spend a lot more time on herbal medicine, and that history is so long. It's been used for so many hundreds and hundreds of years. I know here in America, we tend to have problems with our gut health. And and many people will say that your gut health and your mental health are very interlocked. And I know for me personally, yeah, my gut health and my anxiety can be really interlocked. What have you seen, from your experience with people with gut health and perhaps with mental health challenges?
One of the well-known example is the serotonin that is secreted from the intestine and
Mhm.
affect to the brain function, isn't it?
Mm. Yeah.
When we do the uh, diagnosis, we check the several different things, include the tongue's shape, color, texture,
Oh.
several pulse position, their speed, rhythm, and the quality,
Hmm.
texture of the blood vessel.
Hmm.
Another thing is among 400 acupuncture point of the body, somewhat 20 or 30 acupuncture point is more important, meaningful in the diagnosis perspective too. When we check the acupuncture points, color, texture, or the elasticity, we found these points related the organ's function might be a little bit more excess.
Mm.
Some other group of the organs or the meridian acupuncture point is a little bit depleted.
Yeah.
Then we make the balance to
The
each other.
balance. Yeah.
Especially this the stomach, small intestine, or the large intestine related acupuncture points.
Mm.
Many patients are showing either excess with the very hard, rigid, and cold, or the depletion feels like nothing's there, and then very the dry and poorly developed muscles. So those kind of acupuncture point reaction makes me to more focus on the GI function.
Yeah. Wow. Okay. So, in your experience, do you think that when somebody comes to you, maybe with a mental health challenge or with chronic pain, that it's something that they can overcome, or is it something that really that they will need continuous treatment? Like, do they need to come back for acupuncture treatments, for the rest of their life? If, let's say, they have panic disorder, or is it something that, with time, that herbal medicine and oriental medicine can help maybe decrease those symptoms?
Very appreciate your question, Katie. That's the most common question that I encounter in my practice too.
Is it? Okay.
Well, just like other the psychiatric medication or
Right.
chronic disease, like some blood pressure or the diabetes related,
Sure.
most of my patients, what they heard is that they need to take the pill for rest of their life.
Yeah.
So when I encounter those group of the patient, my answer is no.
Mm.
Although acupuncture and herbal medicine cannot make a very dramatic, the strong effect. However, our practice is not for rest of their life.
Mm.
Only until that we are able to resolve the targeted symptoms and discomforts. Even though we are teaching 200 different single herb,
Mm.
160 different herbal formula,
Mm.
nothing's for the rest of their life. Only for the some several months or weeks. And what the OMD, Oriental Medicine Doctor, do is when we see the patient periodically,
Mm-hmm.
we're checking the testimony, Oriental Medicine, the diagnosis like a tongue quality,
Yeah.
pulse,
Yeah.
and acupoint reaction related like some diagnosis result
Mm.
based on their changed condition improved and reduced the symptoms. Then what we do is we also reduce the intensity.
Okay.
All the acupuncture treatment looks very similar, but in the practitioner side, we are keep on changing the diagnosis, the direction,
Mm.
and strength. When we are able to see the somewhat like a good cases,
Mm-hmm.
patients reduce their discomfort,
Mm.
then gradually reduce the acupuncture strength and change the herb also to make it a bit more simple, more mild,
Okay.
the less strong the herbal formula. Then
Okay.
discontinue.
Yeah. As they achieve balance is. So that's cool. I like that. So, that Western medicine approach, a lot of it is like, yeah, you need to be doing this for the rest of your life. You need to be taking this medicine or nutrient or whatever. And it's hard, like it can feel like a lot for people that they can never get past it. And so I like that there's, we want to be achieving a balance, and then once we find that balance, then it's about maintaining that balance using different methods. It's not your method of treatment and tools changes as you evolve. And so I do really like that approach, that you're continuously monitoring how the patient or the client is doing.
Thank you. What we are known is as a acupuncture and herbal medicine. However, that is only the some types of the well-known modality.
Mm,
What we practice is the Oriental medicine philosophy. Oriental medicine, the lifestyle changes. Acupuncture, herbal medicine is the very somewhat relatively stronger weapon to improve. However, after that, we also give some of the nutrition suggestion, meditation technique,
ooh,
Qigong and Tai Chi, the practice recommendation too.
mm,
Our master program, we also teach the Qigong, Tai Chi, Western nutrition, Eastern nutrition.
cool. That's cool. I want
Hmm,
to do that.
thank you.
I want to practice Tai Chi. I want to try Tai Chi and then to learn more about that difference between herbal medicine, Western approach versus Eastern. I just think is really, really interesting.
Oh, thank you. So for somewhat like some long term, and then for the maintenance, we more emphasize the types of the nutrition to prefer, to avoid.
Hmm.
And Qigong and Tai Chi is also about the yin yang balance.
Okay.
Yin yang balance in the Qigong Tai Chi practice is more about the group of the muscles, just like as we talked before, isn't it?
Hmm.
And I think the Oriental medicine practitioner are the same as marketing outreach associate of the meditation.
Mm.
Our big roots of the Oriental medicine is Taoism. Think about the yin and yang balance, meditation, and energy flow to be more unblocked and then better circulation of the energy.
Yeah.
So, what we more promote is the patient, even without other types of the treatment, within in their the normal life and go to the grocery shopping
Hmm.
and they are able to achieve some better, higher quality of life. So I think that's our goal as an OMT practitioner.
Yeah, that's beautiful. I think that's really amazing. It's a good approach. It's different, and I think that we, as a Western society, really need to be looking at Eastern and Oriental medicine approaches to our mental health, and to balance in our body, because I think that we're all probably struggling over here a little bit, with balance in our body, to be honest. Well, I
Mm.
just appreciate your time so much. This was a really, really interesting, informative conversation. I learned a lot about acupuncture, about herbal medicine, about that approach of our bodies and everything is linked between our physical and mental health. And it's important to find that balance. And so, again, thank you so much for your time. If anybody is interested in becoming maybe a student or in going to maybe get help, maybe they're struggling and they want to maybe try this approach, how could they get in touch with you or with Wangu University?
It might be a little bit confused because we have two different phone number.
Okay.
Yeah, there's the school phone number for the master program,
Okay.
and there's other Wongo Health Clinic phone number.
Okay.
So if you want to try our the acupuncture herbal medicine treatment, then reach out to our Wongu Health Clinic.
Okay.
Want to get to know about this Oriental medicine and regard as your uh, the next next career, next full
Hmm.
time job,
Hmm.
then please contact the Wongu University.
Wonderful. Wonderful. Well, thank you again so much. for your time. Thank you for being such a staple in the community. Wangu, I mentioned before our call, is very good at getting out in the Las Vegas community and really just being a part of our healthcare community. And so I just am glad and grateful that you came on, and it was just wonderful, great conversation. And thank you again so much for joining us.
Thank you for inviting me again. Hope we can have a more chance to introduce the Oriental medicine to the local community.
Yeah, absolutely. We'd love to have you back anytime to talk more on this topic, on maybe even, the Taoism approach to mental health, and to that Oriental approach to mental health that we haven't touched on. And so I think it's so powerful to learn about different cultures. So with that, we will end it here. I just want to thank everyone who's listening in today. And then also, of course, please catch this episode and all of our episodes at katierosewechter.com. And this episode will be posted live by next Wednesday. With that, I will see all of you guys back every first and third Wednesday of the month. And I'll see you in July. Have a great summer, everyone. We'll see you next time.
Thank you.
PR Connections Radio thanks you for watching this podcast. Check out more episodes of this show and our others at prconnectionsradio.com.